Okay, Chapter 6, Lipids, Part 2. Today we'll focus on the diseases and the major cardiovascular risks. At least we'll talk about the modifiable risks that are possible with lipid consumption, and talk about dietary and other lifestyle actions that can help reduce atherosclerosis. So when we look at cardiovascular disease, it is a big umbrella. It's a sorry, apologize. It is a umbrella of diseases. Okay, cardiovascular disease, CVD, is a group of medical conditions affecting the heart and blood vessels. So you have different types. You have carotid artery disease, you have peripheral artery disease, stroke, hypertension, chronic high blood pressure. All of these are different types of heart diseases. Okay. When we look at the interior lumen here of an artery, well, first of all, let's look at the term athero here, meaning hardening, meaning plaque, sclero, meaning hardening, osis, meaning abnormal condition of. Okay. So our sclerosis, the long-term disease process in which plaque builds up inside the arteries, resulting in one of those different types of cardiovascular diseases we talked about just a minute ago. So inside the lumen of an artery, it's pretty smooth, of a healthy artery. It's pretty smooth. It's able to, it has smooth muscle in it. It's able to flex with every beat of the heart under blood pressure, that pressure from every heartbeat. However, when this lining becomes irritated by excess cholesterol or glucose, okay, remember earlier we talked about how blood glucose, high blood sugar, causes irritation within this lining. And that irritation is what can also lead to damage of that lining and lead to more plaque buildup. Okay. Also, cigarette smoking irritates this lining. Certain types of bacterias irritate this lining. And so over time, this leads to the formation of arterial plaques, these lipid deposits that can begin to build up and make this artery narrower and narrower. And this plaque buildup here is the result of what we call a thrombus, this fixed bunch of blood clots that remain in place or can remain in place and irritate blood flow or disrupt blood flow. This is a histograph of a normal arterial lumen, okay, and of a blocked arterial lumen. So you see the blood clot here, you see the irritation, you see the plaque build up along the lumen and how much narrower it is. Okay, you see the arterial wall here, which will be the same as what this was here. And here you have a wide open interstate, and here you barely have a half of a lane left open here for arterial blood supply. So atherosclerosis and cardiovascular disease can develop. And what can make it deadly is you have this thrombus here, which is part of the clot, can break off. And that leads to what we call an embolus. This embolus can end up completely blocking blood flow to your smaller arteries in your heart, and that could lead to a myocardial infarction. This term infarct means death due to blood flow loss. It can occur in the brain, these small arteries in the brain that can lead to a stroke. And that's bad news. Okay. Nobody wants a heart attack and nobody wants a stroke, but this is what causes them. You also have what we call lipoproteins that are going to help transport those essential lipids in the blood that we talked about in part one. Okay, your triglycerides, your essential fatty acids, those kind of things. There are four major types of these lipoproteins: your chylomicrons in the small intestine, your very low density lipoproteins, your high density lipoproteins, and your low density lipoproteins, as you see here. And there are, we'll talk about each one real briefly. They carry different proportions of lipids. They similar, and how do I want to put this? Trans fats affect certain ones differently. Okay. So your high density lipoproteins, which is your HDLs, these are your good cholesterols and are your good lipoproteins. And the way I would teach my clients this is call them healthy. So H stand for healthy. Healthy density lipoproteins are your high density lipoproteins. They transport cholesterol away from the tissues and back to the liver, or to the liver where it can be eliminated, and it does not contribute to plaque formation. Okay. Then you have your low density lipoproteins, okay, or your less healthy, as I would tell my patients, your low density lipoproteins. This is the quote unquote less healthy or bad cholesterol that does carry cholesterol to the tissue and can contribute to plaque buildup. And then your very low density lipoproteins can also contribute to atherosclerosis. So, how can you prevent this? How can you modify your diet and slow down this risk as you age? Well, the two things you cannot change is your age and your genetics. Okay. Like my husband, he has a very strong genetic familial component for CVD. Okay. Grandfather, father. So we know that in advance, and we're making as many modifiable changes as we can. What are those? If you have body fat, excessive body fat, let's work on getting that off. The main thing, the main two here, well, actually, I don't want to just bring it down to two, but exercise, do not smoke, and by all means, oh, please control your diabetes. Okay. Control your insulin resistance, control your diabetes. So, in other words, a low to moderate carb diet and a monounsaturated and polyunsaturated fat diet with good moderate protein. Okay. And exercise. And we'll talk about drinking here in a minute. So when I talk about those fats, let's look at that here when we're talking about assessing your risk. So what does that look like when you go to the doctor every year and you get your annual physical and they do a blood panel and you get your numbers back? What does that look like? So these are the recommendations for low risk. Okay. Like I said, for one thing, we cannot control your age. So especially in males and females, but usually males after the age of 45, females after the age of 55. If there is a strong family history of CVD, you want to get your lipids checked. So total cholesterol below 200, LDL cholesterol below 100, HDL above 60. Remember, those are the good ones. Okay. The healthy, so you want those high. And there's a ratio also here that you want. Okay. I think we've talked about fat. So what does that look like in our diet? Okay, dietary recommendations: consuming 10% of total calories, or excuse me, less than 10% from saturated fats. We want to make sure we consume your omega-3 fatty acids, your omega-6 fatty acids. Remember, these were those essential ones that we cannot get in, or excuse me, that our body does not make. So we must get them in our foods. Okay, so your fatty fish, your salmon, your nuts, your legumes, your vegetables, your whole grains, right? And yes, eggs are good. They are a good source of protein. They are one of the cheapest forms of protein out there. And they, within moderation, and there again, quantify that. I would, in clinical practice, tell my patients, remember, I was more of a diabetes dietitian and nutritionist. So, in moderation, 4, 5 eggs a week, an egg a day, depending on, and if their blood lipids looked good, I'd say go ahead and have your 2 eggs, every other day. We'll keep an eye on it. I'd rather you be eating eggs than, fried foods or hot dogs or lunch meats and those kind of things. So it was a real eye-opening discussion and therapy with my patients back in the day with encouraging healthy fats in their food. Okay. So let's talk now about, well, and don't forget real quick the intake of fiber. Okay. Remember soluble fiber? We talked about carbohydrates and how reducing your added sugars and starches are so important with reducing cardiovascular risk. Okay. High blood sugar damages the arteries, damages blood vessels, just like saturated fat does. So, um, definitely keep that in mind, as well as smoking and not exercising. So let's turn our intake or turn our attention now to alcohol, okay, ethanol. You see here the chemical makeup, a simple 2-carbon compound here. Um, Most of them do contain some type of carbohydrate. Okay, your beers, your wines are going to also have carb in them, so you got to watch out for that. And alcohol is a energy producer, so 7 kilocalories per gram. You see here the alcohol content in certain types of beers, wines, your malt liquors, your distilled spirits, and so forth. Okay. And when we look at how the body processes alcohol, it's interesting. Alcohol does not require digestion. Alcohol is considered a toxin in our body and it's metabolized in the liver. This detoxification starts in the stomach, but most of the alcohol is going to be further metabolized and broken down for metabolism in the liver. And then um, somewhat absorbed in the small intestine. Okay. Most alcohol is absorbed in the small intestine after the liver gets done with the metabolism process. This is why you don't want to eat on an empty stomach. This is why um, drinking binges are not a good thing. And this is also why you have different types of blood alcohol level differences. Okay, remember blood alcohol is the percentage of alcohol in the bloodstream at any given time. And there are several factors that influence that. Okay, so males and females have different physical responses to alcohol. Your males are more typically larger, have larger muscle mass, they have larger livers with an increased blood supply through that. So they can detoxify more alcohol at a particular time. Um, Females have higher serious health consequences when they are heavier drinkers than males, and also um, the quantification of what is a moderate drinker to a heavy drinker varies based on male and female because of these characteristics. Okay, so a moderate drink for males is about 2 drinks a day, females about 1 drink a day, and you see that as it goes down here. Okay, your textbook goes into different types of alcohol disorders and um, what quantifies a person with an alcohol use disorder. So you can definitely take a look at that. You see here how alcohol on a long-term basis can affect the body all the way from the brain down to the colon and rectum, and how chronic alcohol intake over time contributes to intestinal ulcers, alcoholic pancreatitis, as well as kidney issues and cirrhosis of the liver. Okay, excessive amounts of alcohol over time in the bloodstream are converted into fatty acids in the liver, and that leads to scar tissue over time and buildup in the liver, known as hardening of the liver and potentially liver failure. Okay, first you get hepatitis and then eventually liver failure, and you see that here. Okay, healthy liver, cirrhotic liver, scarred liver. Alcohol also on the cardiovascular system is kind of controversial at the moment. Some research is suggesting that light to moderate intake can help raise your HDL cholesterol, meaning, a glass of red wine every now and then. There are some um, the research is still out there. The dietary guidelines for Americans are not recommending people drink a whole lot. And even the new 2026 guidelines have recommended even decreasing that amount of alcohol from before. Okay. Remember that alcohol is a diuretic. Okay. It can suppress the production of your antidiuretic hormone, and that leads the kidneys to excrete more water, which means you pee more, which is going to contribute to dehydration. Also, remember that alcohol is a toxin. It is toxic to the cells, and that includes embryonic cells. And this is where you get what's known as fetal alcohol syndrome or fetal alcohol spectrum disorders, where infants born with this disease have some or can have varying degrees of developmental abnormalities, okay, based on the mother's consumption of alcohol during pregnancy. So this is why no alcohol is recommended for females who suspect they are pregnant or who can get pregnant or who are trying to become pregnant, okay? Also, alcohol should be avoided by people who drive and maintain or use heavy machinery. Definitely look at your over-the-counter medications or your prescription medications. And if you consume alcohol, certain medical conditions can be aggravated by alcohol. And of course, the legal age of 21. If you or you know of anyone who has a drinking problem or an alcohol use disorder, definitely reach out. There are available agencies out there to help you, and you see those, the National Drug and Alcohol Treatment Referral Program here, Alcoholics Anonymous, and other types of resources online. Reach out to me if you need assistance, and I look forward to talking to you guys for Chapter 7. Reach out if there's anything that you need. Thank you.